Hey there! So, you're a pharmacist, and you've been dreaming about taking your career international, right? Well, you've come to the right place. We're going to cut through all the noise and give you a super clear, totally realistic guide on what it actually takes to go global. Let's dive in and map this whole thing out.
I mean, this is the big question, isn't it? It's on the mind of so many ambitious pharmacists, especially if you're in a developing nation. You're thinking, how do I get from here to there? How do you bridge that gap to all those opportunities you see overseas? Well, that's exactly what we're here to do, to help you see the map. Okay, so here's our game plan. First up, we're going to talk about that big dream of yours. Then, we'll get into the nitty-gritty of why pharmacists are looking abroad. Next, and this is super important, we'll do a reality check and bust some common myths. After that, we'll look at a real-life case study, the pathway to the US. And finally, we'll bring it all home to help you figure out, is this journey actually for you? So let's start with the big picture. And I want to be really clear about this. That ambition you feel, that desire for something more, more recognition, better opportunities, more stability, that is 100% valid. It's a huge driver for growth, both professionally and personally. And this right here, this is the core of it, isn't it? On the one hand, maybe you're feeling a bit stuck where you are. The clinical roles are limited, you're not getting the recognition you've earned. But then you look abroad and you see this huge potential for real autonomy, for actual professional respect. That gap between the two, that's the engine for this whole journey. Okay, so it's more than just a feeling, right? What are the actual, tangible things that are pulling pharmacists towards places like the US, the UK, Canada, or Australia? Let's break down exactly what's on the other side. It really boils down to a few key advantages. We're talking about having a clearly defined clinical role where you can actually make a difference for patients. We're talking about structured salaries that reflect your skills, a workplace that's safe and where you're treated with respect, the chance to specialize in something you're truly passionate about, and, of course, having access to the modern technology you need to do your best work. Okay, let's pause here because this next part is absolutely crucial. Having that ambition is amazing, but it has to be grounded in reality. We're about to dive into some common myths, the kind of misinformation that can seriously throw you off track no matter how motivated you are. And here we have it, myth number 1. This is probably the biggest, most dangerous one out there. It's this idea that there's a golden ticket exam. Just pass this one test and all the doors will magically open for you. Look, that's not just an oversimplification. It's a straight-up recipe for frustration and disappointment. So what's the truth? Well, it's a little more involved in that.
The reality is, getting licensed isn't about acing one test. It's a whole process, a journey with multiple steps. It all starts with getting your academic and professional credentials verified, every last one of them. Then, and this is key, you have to complete a certain amount of supervised, practical, hands-on experience. So you see, success depends on the entire process, not just one exam. And here are a couple more critical truths to keep in your back pocket. First, for most of these pathways, you're going to need 1 to 2 years of local experience after you've graduated. They want to see you've worked in the field. And second, those big exams, they're not just testing your general pharmacy knowledge. No way. They're specifically designed to see if you understand the laws and the healthcare system of that specific country. All right, so this all might feel a little abstract. Let's make it real. We're going to use the United States as a case study and walk through the actual process. This is all handled by an organization called the FPGEC, which stands for the Foreign Pharmacy Graduate Examination Committee. And this really shows you what I mean by a multi-step process. Look at this. Step 1. You've got to pass the FPGE, which covers your pharmacy knowledge and the TOEFL for English. Step 2. You have to complete a massive internship. We're talking 1,000 to 1,500 hours of hands-on work. Only after all that can you move to Step 3, passing the NAPLEX, which is the big licensure exam. And you're still not done. Step 4 is passing the MPJE, which is a state-specific law exam. Okay, let's talk about the money, because you have to be prepared for this. It's a big investment right from the very beginning. Just to apply, you're looking at $550. Your first shot at the exam, that's another $650. And if you have to retake it, it's even more. And listen, all of that is non-refundable. Plus, this is just the tip of the iceberg. This doesn't include travel, your study materials, or the fees for all the other exams you have to take. To give you a sense of the timeline,
Just look at these dates for 2025. For just this one exam, from the day registration opens to the day you get your results, we're talking about 7 months. It just goes to show you your planning and your timing have to be spot on. So when you pull back and look at the whole picture, from that very first application all the way to getting your license, you really have to see this as a marathon, not a sprint. On average, you're looking at a 2 to 4 year commitment. Yeah, it's a long haul.
But why would anyone go through all of that? The time, the money, the stress. Why? Well, here's the other side of the equation. This is the big motivator. The potential average salary for a pharmacist in the US is sitting at around $150,000 a year. That is a life-changing number, and for a lot of people, that makes the whole tough journey absolutely worth it.
So that brings us to the final and honestly the most important part of this whole thing. We've looked at the path, we've been honest about the challenges, and we've seen the incredible rewards. Now it's time to weigh it all out and make a decision that's right for you.
And really, it all comes down to this balance sheet right here. On one side, you've got the hurdles, and they are significant. A lengthy 2 to 4 year process, some pretty high costs, and let's not forget the huge challenge of navigating the visa system. But on the other side of the scale, you have the rewards, a potentially massive salary, the opportunity for deep clinical specialization, and the chance to build a whole new life for yourself and your family. And that's really it. We've laid out the map for you, the real-world facts, the tough challenges, and the incredible destination at the end. So the only question left is for you. You've seen the path. Are you ready to walk it?